Hello, and welcome to Epstein Becker Green's webinar, Investments in Behavioral Health, Drivers and Outlook, the last installment of our Behavioral Health Crash Course webinar series. Before we begin today's presentation, please be informed that today's webinar is being recorded, and the participant phone lines will be placed on mute throughout the program. You are also welcome to submit questions directly to the presenter following the webinar, and contact information will be displayed at the end of the presentation. In approximately 2 to 3 business days following the webinar, Epstein Becker Green will communicate the availability of the webinar recording and access to PowerPoint materials. We are pleased to have Epstein Becker Green's Purvi Maniar, who is a member of Healthcare and Life Sciences and Corporate Services Practices. At this time, I'd like to turn the webinar over to Purvi.
Thank you very much. Good afternoon. In this behavioral crash course session, we will discuss the drivers of ongoing investment in behavioral health today, as well as the outlook for new investment in behavioral health services in the United States. Specifically, we'll go over the prevalence of behavioral health issues today, the importance of addressing them, and the increased reimbursement coverage that has become available in recent years, which creates a demand that far outpaces the supply of effective services that are available today. This demand and the fragmentation of available options for treatment of behavioral health creates a market that is ripe for further consolidation as well as organic growth and expansion. The United States has the highest prevalence of mental disorders in the world. According to one study, 27% of the U.S. population is at risk in any given year for a behavioral health condition, and 47% of the population is at risk during their lifetimes. Compare this to 18 to 21% of the population being at risk in the next 3 highest prevalence countries, or 6 to 7% in the lowest prevalence countries. On the substance abuse side of behavioral health, drug overdose deaths have recently become the leading cause of injury death in the United States, including deaths involving prescription opioids, which have quadrupled since 1999. Earlier this year, the U.S. Preventative Services Task Force released a final statement recommending standardization of depression screening by primary care physicians for adolescents ages 12 through 18 and adults, including pregnant and postpartum women, along with adequate systems for effective treatment and follow-up. It is believed that depression is a top cause of disability in developed countries, and so as this recommendation is implemented, it is likely to result in further increases in diagnosed cases, as well as increases in the demand for resources required to address depression. There is a high comorbidity between medical and mental conditions. It's been found that 75% of high users of hospital inpatient services had behavioral health diagnoses versus only 32% of patients who were not high users. The medical community recognizes that healthcare services are likely to be more intense and associated costs higher when there is a mental disorder present in patients, and that the cost of mental health treatment can be more than paid for through reduced hospital stays, emergency room visits, and other treatment costs. Today, there's an increased awareness and decreased social stigma associated with behavioral health. Public health education and better diagnostic tools have created greater awareness and understanding of behavioral health disorders. And the understanding and acceptance of mental health conditions, including substance abuse as a disease, has, in turn, helped decrease the social stigma associated with seeking help. In addition, advancements in therapy and medication management have yielded new and better procedures for treatment of mental disorders and substance abuse disorders. And another driver is the need for clinics to develop youth, elderly, and gender-specific programs to address behavioral health conditions. This increased awareness, as well as the availability of improved therapies and medications, will continue to increase the number of overall diagnoses and the ability and demand to address behavioral health conditions. Recent years have seen a continued increase in reimbursement coverage available for behavioral health. The Mental Health Parity and Addiction Equity Act of 2008, which is applicable to large group plans, builds on the 1996 Mental Health Parity Act, which equalized annual or lifetime dollar limits for behavioral health conditions as compared to medical conditions. The 2008 Act equalized cost sharing, treatment limitations, and out-of-network coverage between behavioral health conditions and mental health and medical conditions. Further, the Affordable Care Act expanded the Mental Health Parity and Addiction Equity Act requirements from large group plans to most individual and small group plans, as well as plans offered on health insurance exchanges, where behavioral health coverage is an essential health benefit. Further, in 2016, this year, CMS issued final regulations regarding parity requirements for private insurance, which will require additional compliance efforts by plans. And Medicaid this year has expanded coverage for standalone psychiatric hospitals, which will allow standalone psychiatric hospitals into the Medicaid network for the first time. This increased Medicaid coverage is important because behavioral health conditions are 2 times more prevalent in federal health program beneficiaries than in the general population, and also because Medicaid is the largest payer of behavioral health services. Next slide. Addressing behavioral health can advance the goals of today's quality and value-based healthcare delivery environment. It can addressing behavioral health can increase the effectiveness of ACOs, bundled payments, and other value-based payment models. To the extent that there are payments available for chronic care management and care coordination activities that apply to behavioral health, these will enhance the overall value and quality proposition of these alternative payment models. And providing effective care for behavioral health disorders can advance the triple aim of healthcare that is widely accepted today, which is the improvement of the patient's care experience, improvement of the health of patient populations, and decreasing the per capita costs of healthcare. The key here really is integration and care coordination between behavioral health and medical conditions. And there's a lot of room for that to actually happen because the quality metrics and pay-for-performance models of today that are geared towards behavioral health are relatively undeveloped, and there's a lot of room for improvement that is apparent. However, one can see the real opportunity here as the potential for savings with improved management of behavioral health conditions is significantly greater than it is for patients without behavioral health concerns. Recent years have already seen record growth in behavioral health mergers and acquisitions. In 2014, which is the most recent year for which we have data, healthcare M&A activity has increased by 18%, but behavioral health has increased by 24%. There's been a rise in behavioral health deals from 21 deals in 2010 to a record number of 43 deals in 2015. Some representative national providers include Acadia Healthcare Company, Universal Health Systems, and Pyramid Healthcare, Inc. And you can see a number of facilities and recent acquisitions by each of them. However, the market continues to be fragmented, at least a majority of the market that remains, with over 16,000 plus addiction treatment centers in the U.S. It turns out that a majority of the operators are still only own 1 or 2 facilities, and of the over 500 freestanding inpatient psychiatric facilities, there are very few operators that own more than 10 facilities. Given the industry's significant long-term growth opportunities and the highly fragmented nature of available care, we expect that transactional volume will continue to grow in coming years. What is the outlook for behavioral health in the coming years? We believe that there's a continued opportunity for consolidation and growth due to the high prevalence, increasing diagnoses, and development of new therapies, due to the continued expansion of reimbursement coverage and the movement towards true parity, the movement towards value-based payment models, integration and coordination in behavioral health, and that these factors, combined with the chronicity of mental health conditions and the market fragmentation that we just talked about, create continued opportunities for consolidation and organic and de novo growth. However, we expect to see a significant amount of competition from hospital systems, which will compete with specialty providers in behavioral health. Generally, hospitals across the country are increasing funding for behavioral health services as part of their strategy to improve patient access to behavioral health and the overall medical care that is provided to them. The cost of adding beds for a hospital to an existing system is generally lower than the cost of acquiring beds by a specialty care provider or private equity. In fact, 9% of general hospitals report that they have behavioral health projects under construction, and another 11% report that they have projects on the books. The American Hospital Association hospital construction surveys of 2014 and 2015 report behavioral health as second highest in terms of priority among specialty hospital projects. These percentages are a marked reversal from recent years when expanding psychiatric care was considered a drain on hospital finances. And so, as I said, we expect this trend to continue with respect to hospital systems investing in behavioral health, and that'll create competition between specialty care providers in behavioral health as well and hospital systems. We expect to see an increased focus on compliance and enforcement in the behavioral health space, as there is an increase in legal requirements that become applicable due to the third-party reimbursement as specialty hospitals look to that rather than self-pay. Large multi-state operators will invite increased scrutiny as compared to the smaller operators that have traditionally been in the space that exist within one state and rely on self-pay as compared to operating across multiple states and relying on governmental as well as commercial reimbursement. The compliance requirements applicable to mental health can be more stringent than for traditional health and will vary by state. Some of those areas were previously covered in this crash course series, and it's important to remember that they vary by state and are often more stringent, for example, in the area of privacy for behavioral health than they are for traditional health care. In the area of mental health parity, a lot of progress has been made towards parity, but there is more progress to be made before true parity is achieved. And we believe that there'll be a focus, increased focus on both compliance in this area as well as enforcement. There will be focus on compliance with licensure requirements, licensure of the facilities providing behavioral health conditions, as well as the programs that they operate, in addition to licensure of the professionals who are providing the care. Next is the corporate practice of medicine, which was also discussed earlier in this series in detail. Many states restrict non-physician ownership and control of facilities employing physicians and professionals, and there are specific ways to comply with corporate practice requirements, which vary by state, and enforcement varies greatly by state. Next is privacy, and as I mentioned before, there are varying and strict standards which are not preempted by HIPAA in the area of behavioral health, which need to be complied with. Also, fraud and abuse laws, federal, state, anti-kickback, and self-referral laws become applicable to behavioral health providers as they consolidate and seek third-party reimbursement. And certificate of need laws, which are applicable in many states, to the construction, expansion, and change of ownership of facilities. These can require a lengthy state review and approval process based on assessment of public need. So in conclusion, behavioral health providers have an opportunity in front of them, as do investors in the behavioral health space, to help close the gap between the increased demand fueled by increased and continuing increase in reimbursement coverage. But they need to understand and factor in the cost of compliance and the time and effort involved, as well as restrictions on the sharing of profits into their analysis of the market opportunity in a given state and their overall behavioral health business model. And that concludes our session on investments in behavioral health, as well as this crash course series on behavioral health. I hope that you found it to be informative and useful. If there are any questions, please feel free to contact me or any of the other speakers. My information is below, and you have the contact information from the other speakers from their presentations. Thank you, and have a good afternoon.
Thank you, Purvi. In approximately 2 to 3 business days following the webinar, Epstein Becker Green will communicate availability of the recording and access to PowerPoint materials. Thank you for attending.